I'm going to talk about hormones and the menstrual cycle. I'll talk about a brief version or a foundation version of 2 hormones and how they affect it, and then I'm going to do a larger one with more detail on all 4 hormones, which are estrogen, progesterone, FSH and LH. And I would also like to talk about the use of hormones for reproductive technology, for helping couples have children if they can't have children for whatever reason. Now, you may come across a chart that looks something like this. This has got lots of different things going on. At the very bottom there, you've got the days of the menstrual cycle. You go from 0 up to about 28. Above that, you've got a picture of the uterus lining, which gets thinner and then it gets thicker again. Really, that's a graph. I know it doesn't look like a graph, but it is a graph. Higher above that, you've got what happens to the egg. And you've got the developing follicle and it releasing an egg and then it changing into something called the Corpus Luteum. And then you've got 2 graphs of different hormones. Now on the foundation version, you don't need to worry about the top one, but higher, you need to worry about both of those graphs. And we'll have a look at those. So foundation just looks like that. So, the foundation one, not really simple. It's not simple at all. It's got lots of different things going on. So, for example, they've spelled estrogen without an O. That's just the American spelling. So it's estrogen or estrogen, you'd hear it pronounced sometimes. Now, firstly, at the very beginning, you have estrogen being produced by the follicle. The follicle is where the egg comes out of. It's a tiny little pocket within the ovary. And as well as producing the egg, it produces something called estrogen. And you can see there the estrogen is rising. As the estrogen rises, the effect that has on the uterus lining is that the uterus lining gets thicker and thicker. So the egg developing causes a hormone which causes the uterus lining to get thicker. And eventually it peaks. And when it peaks, when the estrogen level peaks and gets particularly high, that causes ovulation. It causes the follicle to release the ova and off it goes on its journey towards the uterus. The follicle itself at that point sort of changes, and once it's lost its egg, lost its ovum, it changes to something called the corpus luteum, which is really a sort of, if you like, it's a dead follicle, but it's not dead because it is still producing hormones. It still does things, even though its job for producing eggs is done. Anyway, it produces this chemical, this hormone called progesterone, and that rises. And when that rises, that sends a signal through the blood, travels to the uterus lining, and it says, stay where you are. You stay nice and thick and stay there just in case a fertilized egg cell comes along. Now, later in the cycle, both progesterone and estrogen both drop. And when they both drop together, that has an effect. And when they both drop, the uterus lining starts to fall apart, and you can see it there is what we get, the period. The thing you can actually see what looks like blood coming out of the vagina, and that reduces. And then we're back to the start. That there is what's required for the foundation, just looking at 2 hormones and how the follicle and the corpus luteum affect the egg and how they affect the uterus lining. But I'm going to go to a more difficult one now. If you want to try and draw that one out, possibly that would be useful if you're doing foundation. But if we're going to higher, we're going to look at one that's more complicated. So firstly, the pituitary in your brain makes a hormone called FSH, which stands for follicle stimulating hormone. The follicle stimulating hormone travels through the blood and it goes to the follicle. The follicle is where the egg cell develops. And as well as developing and starting to mature and starting to get ready, the follicle starts to produce a hormone, and the hormone is called estrogen, and that starts to rise. Now that rising estrogen causes the effect of the uterus lining becoming thicker. It thickens up, and so it goes on, and eventually it peaks. When the estrogen peaks, what happens is another hormone is released. The estrogen doesn't just go to the uterus lining, it travels all throughout the body, it goes through the blood, and it goes all the way up to the brain. And in the brain, the pituitary gland makes something called luteinizing hormone. And you can see that there, that spikes really suddenly. When the estrogen gets high, that suddenly causes a massive spike in luteinizing hormone. Now the luteinizing hormone travels through the blood, it goes all around the body. We're now back down to the reproductive system. It goes to the follicle and it tells the follicle to release the ova, and that bursts out and it goes ready to start travelling down the fallopian tube. And it also stimulates the follicle, the sort of almost dead follicle, to become this thing called the corpus luteum, and it tells the corpus luteum to start producing things, and the corpus luteum starts producing the hormone called progesterone, and the progesterone increases. Progesterone causes the uterus lining to stay thick. It's a signal to say, just to say to the uterus lining, there may well be a fertilised egg coming your way, in which case we'd better have the lining nice and thick. But the progesterone also travels back through the blood, and it goes back to the brain, and when the progesterone gets to the brain, it tells the brain and the pituitary gland to stop making so much luteinizing hormone, stop making so much FSH, and reduce those down. Now, after some time, the progesterone goes down, and it's time for the estrogen to go down as well, and when they both go down, that causes the uterus lining to start breaking down, and you can see that over the following days you get the period happening. But also the progesterone goes up to the brain again. The lack of progesterone, I should say, because there's not much progesterone now, that goes back up to the brain and it causes the pituitary to start making more FSH, more follicle stimulating hormone. So we're now back to the start. The follicle stimulating hormone is starting to go higher again, which causes another follicle to start developing, and so we go on. You should be able to look at that and annotate it and talk about it and have a reasonably good idea what's going on, and maybe draw some arrows on it and that sort of thing. It is complicated, I do totally accept it's quite a difficult thing. There we have got 4 different hormones. You've got down the left hand side you've got the names of them, and they travel in the order FOLP, follicle stimulating hormone, estrogen, LH, progesterone, and then we go back to the start again. That tells you where they're made, and it also tells you what they do. It's what they do to the body and what they do to the different hormones, which ones they start and which ones do they reduce. So I'd like to just quickly talk about assisted reproductive technology, and that is just ways of helping couples have children if they can't have children themselves for whatever reason. And there's a number of reasons why people can't have children. So, for example, you get problems with women not being able to release eggs for some reason. They get blocked fallopian tubes. Sometimes you get problems with the uterus lining, and you can have hormonal problems just causing various things not to function properly. Men, you can have a low sperm count, famously from smoking too much cannabis and drinking too much alcohol. You can have poor quality sperm. You can have blocked tubes or damaged tubes that are supposed to carry the sperm from one place to another. And you can also have hormonal problems. It is possible for women, and I'm concentrating on hormones here, so I'm concentrating on the women and how hormones can help women have children. There's various different types of one, but they basically trick the body into producing more eggs one way or the other. So some of them contain FSH, and you can have injections of FSH, and basically FSH stands for follicle stimulating hormone. So that stimulates your follicles. It starts the follicles to start producing more eggs. There is something called IVF, which is sometimes known as test tube babies. It stands for in vitro, which is the Latin for roughly for in glass, which is why people call it test tubes. It isn't actually a test tube because you've got to get various equipment into it and do various things to it, and you couldn't do that in a test tube. But it's done in a piece of glassware, and they go into a woman and they take out some egg cells, they get some sperm cells from a man, and then they mix them together in some glass, and they wait a day or two, and they allow them to develop, and if they become embryos, then they can implant them back into the woman. But to do that, to implant them back into the woman, the woman has to have a thick uterus lining. Therefore, as well as taking the things out, as well as mixing them together, as well as implanting them, they've got to have treatment done. She's got to have follicle stimulating hormone so that she releases them so that they can be gathered and harvested, and also she's got to be given some progesterone so that the uterus lining gets thick, so it's ready to be implanted back into. There's also something called Clomiphene or Clomiphene therapy. Clomiphene therapy is, again, it's just tricking the body to do various different things. And what it does is it decreases the level of estrogen. When you take Clomiphene, the estrogen reduces, and that stimulates your body to start producing FSH and LH. And when they start producing those, FSH develops more eggs, and then LH causes one to be just to be released. So that means you release them, and you know when they're going to be released. So you know exactly when to have sex, and so hopefully, if you know when to have sex because the egg's been released, you've got more chance of being successful. It's part of a negative feedback loop, whereby the estrogen stops LH, but if you put the Clomiphene in there, it blocks the estrogen, which then therefore allows the LH to be produced.